Hi, my name is Christos Rammos from the Department of Cardiology and Vascular Medicine from the University of Duisburg-Essen. And we have analyzed the gender differences in peripheral artery disease in Germany from 2009 to 2018. Well, actually, we know that more than 200 million people worldwide suffer from peripheral artery disease. And of course, we know that lipid lowering and antiplatelet therapy are the most important tools in reducing the burden of cardiovascular disease. But however, despite clear guideline recommendations regarding medical treatment in these patients, implementation is still inadequate and depends on social status, race, and gender. And gender differences are becoming increasingly important, especially in patients with atherosclerosis. And we know that women experience higher system delays and receive less aggressive invasive treatment and pharmacotherapies. Now, if gender-based inequalities in outpatient care and medical treatment in peripheral artery disease patients exist, has not been elucidated in depth. So we aim to investigate the gender differences in prevalence, care, and treatment of PAD stratified by intermittent claudication and CLTI in this nationwide cohort. Well, actually, we didn't have this kind of inclusion and exclusion criteria as we analyzed claims data, ambulatory claims data for all statutorily insured patients in Germany, which is comprising 70 million patients per year and nearly 87% of the German population. The remainder of the German population, so 13%, are privately insured and were not included due to the lack of availability of the data. And prevalence was, of course, stratified by age and gender within the study frame from 2009 to 2018. In total, we had 17 million patients with PAD that were identified, of which 47% were female. And we observed that, of course, that gender is an important factor affecting presentation to a vascular specialist and to medical therapy. And our data highlight that female patients in Germany are both less likely to present to a vascular specialist and to receive guideline-recommended medical therapy compared with male patients. And alarmingly, the prescription rates of statins even decreased with advancing stages of the disease and were lower in patients with CLTI and patients with intermittent claudication. And with more advanced stages of the disease, with CLTI, women were even less likely to receive a statin than male patients. Our results demonstrate that we have a gender-based difference in pharmacotherapy and specialized outpatient care in patients with peripheral artery disease. And while overall outpatient treatment by vascular specialists and guideline-recommended therapy are low, women and especially patients with CLTI remain undertreated. And our data finally indicate that women with peripheral artery disease experience an even greater delay in diagnosis and greater insufficiencies in treatment, despite having at least the equal burden of disease to male patients. Our work calls for more awareness work to be done to sensitize the medical professionals and patients alike to implement guideline recommendations for PAD patients, and in particular to help bridge this gender inequality. Our claims data now enable the collection of large amounts of information. However, the design of the study means that the interpretation of those data only allows for drawing correlations and not direct causalities. So we believe that we have to analyze more in depth the causalities and go down to a patient level data to draw further conclusions. And of course, we have to account for treatment adherence to the prescribed pharmacotherapy. And finally, there was no insight into the laboratory measurement. So this would be the next step for further studies.